Live from the Centers for Disease Control and Prevention Import Permit Program in Atlanta, this is the Federal Partners Import-Export Regulations webcast. I am Lourdes Mueller. Good morning, and welcome to our webcast. The topics will cover salient features of the regulations, policies, and guidance that govern users of the Import Permit Program. We have exciting guest speakers and topics for today. Joining us are presenters from the Biomedical Advanced Research and Development Authority at the Office of the Secretary for Preparedness and Response, Department of Health and Human Services, the U.S. Customs and Border Protection, the Department of Commerce, Bureau of Industry and Security, Office of Chemical and Biological Controls Division, the Department of Transportation, the Food and Drug Administration, the USDA Animal and Plant Health Inspection Service, and our very own CDC Global Migration and Quarantine at CDC, and Vaughn McLean. Housekeeping before we go to the order of presentations. Please send your questions to ipwebcast@cdc.gov. And if you experience some technical difficulty, please contact your IT department. I'm now going over the speakers according to the order of presentation. Vaughn McLean is the Chief of the Program Services Branch, which includes the Import Permit Program at the Division of Select Agents and Toxins, Office of Public Health Preparedness and Response at the CDC. He will be followed by Adam Langer of the Division of Global Migration and Quarantine, then Abu Sayed and Deborah Defisi from the USDA APHIS. After them, Romelito Lapitan will discuss the regulatory role of the Customs and Border Protection Service at the U.S. Port of Entry. After Dr. Lapitan's presentation, we will have a short break. We will resume promptly at 1:15 p.m. After the break, Bill Stevens will talk about transporting infectious materials and inspection processes. He will be followed by Dr. Wesley Johnson of the Department of Commerce, then Dr. Jessica Dunn of the Food and Drug Administration follows. Mr. Thomas Wharf will share his Ebola response and the permitting experience. After the question and answer session, we will introduce the speakers, and we do encourage everyone online to please send your questions to ipwebcast@cdc.gov. Now to our speakers. The first speaker is Vaughn McLean. He is the Chief of the Program Services Branch, which includes, among others, the Import Permit Program. Vaughn will give us an overview of the Import Permit Program at the CDC. Vaughn?
Thank you for that introduction, Dr. Mueller. And I'd like to give a special thanks to all of you all for attending our third annual Import-Export webcast. Now, this is the first webcast where we have representatives from all respective agencies here to provide information to you all today. I hope that this information is useful as we continue to provide guidance and outreach to the regulated community. I would like to start my presentation by speaking briefly about the Public Health Services Act, which is an introduction to the CDC's import permit regulations. Without the Public Health Services Act, there would be no regulations. Section 361 of the Public Health Services Act authorizes the HHS Secretary to make and enforce regulations necessary to prevent the introduction, transmission, or spread of communicable diseases from foreign countries into the United States. Now, this act also authorizes the HHS Secretary to use inspections as a public health measure to ensure that such regulations are carried out. Now, later during my presentations, you will have the opportunity to hear regarding our inspection process, and also you'll receive information about the things that you should do to prepare for those inspections. Now, this slide here just shows a brief summary of the import permit regulations. I didn't want to go into too much detail in regards to the regulations, but I thought there were 4 points that are very important in regards to the regulations themselves. As it states here under 71.54, a person may not import into the United States any infectious biological agent, infectious substance, or vector unless it's accompanied by a permit issued by the CDC, unless the importer is in compliance with all of the permit requirements, unless the importer has implemented adequate biosafety measures for work being conducted, and also unless the importer takes measures to help ensure that the shipper complies with all applicable legal requirements concerning the packaging, labeling, and shipment of infectious substances. Now, later today, you have the opportunity to hear from Mr. Bill Stevens from the Department of Transportation as he provides additional information about how you should properly package, label, and ship this material into the country. Types of material that require an import permit. And briefly, I'd like to talk about the different types. There are 3 types mainly, which are your infectious substances, your infectious biological agents, or your vectors. And in regards to infectious biological agents, this is your category where your cultures of your isolates come into play. Infectious biological agents are determined to be a microorganism, including but not limited to bacteria, including rickettsia, viruses, your fungi or protozoa, or prion, whether they are naturally occurring, bioengineered, or artificial, or a component of such microorganism or prion that is capable of causing communicable disease in a human. The next category is your infectious substance. Now, this is where your diagnostic samples come into play also. Infectious substance is defined as any material that is known or reasonably expected to contain an infectious biological agent. Now, an example of this would be blood that you could potentially collect from an HIV-infected person. Now, that particular sample should be reasonably expected to contain an infectious biological agent, and it will require you to have an import permit. The next type is your vector, and it is defined as any animals, whether they are vertebrate or invertebrate, including your arthropods or any non-infectious self-replicating system. For example, your plasmids or other molecular vectors or animal products, such as your mounts, rugs, or other display items composed of the hide, hair, skull, teeth, bones, or claws of an animal that are known to transfer or capable of transferring an infectious biological agent to a human. Now, examples of vectors would include your mosquitoes or even your molecular vectors that will require an import permit from the CDC's import permit program. Now, this slide here just gives you a little bit of insight into the number of permits that we've issued from 2000 to 2015. For the last couple of years, we've been averaging around 2,000 permits issued per year. Now, this number does not include the number of shipments that are actually imported into the country. So this is just the unique number of permits that are issued on an annual basis. So 2,000 permits could actually equal over 100 or 2,000, 100,000 permits or shipments that are imported into the country. Dates and conditions of the permit itself. Now, the CDC permit is only valid for the time period or time indicated on the permit, and only for so long as the permit conditions continue to be met. So after the expiration date passes, you're still required to comply with whatever conditions are placed on that particular permit. So 5 to 10 years down the road, if you're still conducting research or if you're still in possession of this material, you still must comply with those conditions. Now, the dates that are indicated on the permit are only the dates that you're allowed to import this material. After that date expires, then you must comply with these conditions continuously until that material has either been transferred or destroyed at your facility. On this slide is just an example of what the permit looks like. Most of you who are participating in this webcast I'm sure are familiar with the permit itself. I wanted to share with you briefly some of the conditions of issuance that we may place on a permit. These are some of the most common conditions that you will find on the permit itself. The first permit or condition is the USDA permit may be required condition. In this particular situation, if you're importing, like for example, the zoonotic pathogen that will be infectious to both humans and animals, in that situation, you will be required to have a CDC import permit and a USDA permit for importing that type of material. Additional conditions is that you should be restricted to following the conditions or guidelines found in the BMBL and should be considered when you're developing your guidelines or developing your biosafety measures for your facility. The next condition is that material must be packaged and labeled in accordance with all applicable laws. And lastly, subsequent distribution being prohibited. Now, in this particular condition, it's typically used for importing novel viruses or those viruses of concern that we want to keep track of and ensure that other facilities that are receiving this material are also working with them safely. So after importation, if you wanted to distribute that material to another facility, you'll be required to have an additional permit to do that, which will be require you to submit an application to receive that permit to transfer it to another facility. Hand carrying infectious material. Now, if you don't take anything from my presentation, I definitely want you to remember this particular slide. In order to ensure the safety of the public, the CDC's import permit program will no longer approve the importation of infectious material if it's being hand carried in the cabin of a passenger aircraft. Now, there are two main concerns with this, and the main concern is protecting public health and ensuring that the public is not at risk for samples being hand carried in the cabin of a passenger aircraft. The other reason, or the other concern, is that you'll be in violation of 49 C.F.R. 175.75b, which specifically states that no person may carry hazardous material in the cabin of a passenger carrying aircraft or on the flight deck of any aircraft. Due to these concerns, the CDC's import permit program will no longer approve applications that indicate that you will be hand carrying material into the country via an aircraft. Which leads to my next topic regarding denials, revocations, and suspensions. Now, a permit can be denied, revoked, or suspended if the biosafety measures of the permit holder are not commensurate with the hazard posed by the infectious biological agent, infectious substance, or vector, and if the permit holder fails to comply with all conditions, restrictions, and precautions specified in that permit. Now, the good thing is that you do have the ability to appeal this decision in writing to the CDC director if you so choose to do so. Now, I'd like to switch gears a little bit now and talk about the types of material that does not require an import permit. Now, the first type, with the exception of bat or non-human primate specimens, is diagnostic specimens that are not known by the importer to contain an infectious biological agent or suspected by the importer of containing an infectious biological agent. Now, an example of that includes your healthy human specimens or samples that are collected, material that has been rendered non-infectious, any material that is non-pathogenic to humans, for example, your non-infectious diseases, and also any non-infectious material, for example, your formalin-fixed slides would not require a CDC import permit. The next type is your extracted DNA. So if your material consists of nucleic acids that cannot produce the infectious form of any infectious biological agent, it does not require a CDC import permit. Now, example of that includes your extracted DNA from bacteria or your viral nucleic acids that cannot produce infectious biological agents. Now, your positive-stranded RNA viruses, the DNA from positive-stranded RNA viruses, would not fall into this category because of their ability to produce infectious virus. So if it has been determined that the material you're bringing into the country does not require an import permit, you have to have what we call a certification statement with your shipment. So it's either one or the other, the CDC import permit or the certification statement. Now, CBP will be looking for one of these two things when this material arrives at the border. So this certification statement is basically a detailed description of the material and a statement on official letterhead signed by the sender or the recipient, clearly stating that the material is not known or suspected to contain an infectious biological agent, and how the person making the certification knows that the specimen does not contain an infectious biological agent, or the basis of the belief that there is no reason to suspect that the specimen does not contain an infectious biological agent. Now, I'd like to switch gears a little bit now and talk about one of the most important pieces of the import permit program and process, and that is the inspections. Now, prior to developing and implementing this inspection program, our process was basically a paper in, paper out process, where we were just trusting that the applicant were doing the things that they indicated on their application. Now we're moving more toward a trust but verify approach prior to issuing these import permits. Now, as it states here on the 71.54, issuance of a permit may be contingent upon an inspection of the importer's facility by the CDC to evaluate whether the importer's biosafety measures are commensurate with the hazard posed by the infectious biological agent, infectious substance, or vector, and the level of risk given its intended use. Now, this is an opportunity for us not just to verify the information on your application, but it also allows us the opportunity to verify that you have implemented the proper biosafety measure and to ensure that the work is commensurate with the hazard posed by the infectious biological agent, infectious substance, and or vector to be imported. Now, these inspections typically take 1 to 2 days. There are a set of items that the inspectors will be taking a look at while they're on site at your facility. A majority of the inspections that we've conducted so far have been for your BSO3 type facilities. However, there is a set of criteria that we use to determine if an inspection may be required. So that criteria includes your biosafety level where your work will be conducted, risk of the agent and work conducted. And one thing to note here is that if your facility is currently being inspected by the Federal Select Agent Program, it would not have to have an additional inspection by the CDC's import permit program. Now, this was an attempt by us to ensure that we were reducing the burden on the public by not requiring 2 inspections from 2 different programs for the same laboratory. Now, this list that you see here is definitely not all inclusive. There are some other items that will trigger the need for an inspection if we feel the need to do so. Some of the common agents associated with inspection include your TB. TB accounts for probably 70% of all of our inspections that we've conducted so far. Other agents include your MERS, coronavirus, chikungunya virus, and also your avian influenza H7N9 virus. Now, majority of these, as you can see, are involved with outbreaks. And due to that, we attempt to do everything that we can to prevent your permits from being held up in regards to any participating in an outbreak that may be occurring with your specific laboratory. Other common descriptions of work include your research, human diagnostic testing, animal studies, and also molecular biology research. Now, this graph here just shows the total number of inspections that we've conducted for the last couple of years. We've been averaging around 40 to 45 per year. Right now, our main focus has been on the BSO3 or ABSL2 or ABSL3 type facilities. We are looking to revert some of that attention to your BSO2 facilities also. We're finding that a lot of the problems are actually at those BSL2 type facilities that also need inspection. In addition to that, we're finding that a lot of your laboratory-acquired infections occur in these BSL-2 type facilities. So in the coming years, starting next fiscal year, we're going to start conducting inspections of not only just your BSL-3 type facilities, but also your BSL-2 facilities. And reviewing your biosafety measures, the inspectors will be taking a look at focusing on your practices and procedures. Now, while they're on site, they would not need to see your entire facility. They'll be focusing mainly on the material or the areas where you will be working with the imported material. So in addition to that, they'll like to see your annual biosafety cabinet certifications while on site. They'll take a look at your HEPA filter certifications, and also your BSL-3 design and operational re-verification records. Now, one thing to note is that the DSAT recognizes the BMBL as the national biosafety standard, and accordingly, your entity should consider this guidance found in the BMBL when developing your biosafety measures. Now, in addition to using the BMBL, I definitely would advise you to also take a look at our checklists that are on site. These are our actual checklists that the inspectors will use while at your facility. So it would be advantageous to you to take a look at that checklist in order to prepare for your upcoming inspection. Now, for the next couple of slides, I'll be focusing mainly on your BSL-3 practices and procedures and some of the things that the inspection team will be reviewing while they're on site. Now, again, this list is not all-inclusive, but some of the things include your practices to ensure procedures are performed to minimize the creation of splashes and or aerosols. They'll be ensuring that proper hand washing procedures are in place. I think you'll be surprised at the number of facilities that we visit where they are not properly washing their hands or washing their hands at all prior to leaving the laboratory. The next thing that the inspectors will be reviewing is your decontamination and waste handling procedures for your cultures, stocks, equipment, and other potentially infectious material. We'll take a look at your procedures for use of biosafety cabinet and also your proper use of PPE, for example, your eye protection or solid front gowns, gloves, or even your respirators. And if you are using respirators, for example, your N95s or N100s, those laboratories should definitely be fit tested prior to wearing those types of respirators. Specifically regarding the laboratory facility, the inspectors will be reviewing whether or not you have a hands-free or automatically operated sink, which is very standard for a BSL-3 type facility. Take a look at to make sure that you have the availability of eye wash stations, the use and availability of an autoclave, and also a ducted air ventilation system. Now, this system should be drawing air into the laboratory from clean areas toward potentially contaminated areas. And also, this ducted air ventilation system should have a means for verification of directional airflow prior to the laboratorian entering the laboratory. Now, briefly, I'd like to share with you some of the common observations noted during these inspections that we've been conducting for the last couple of years. The first one is improper dunning and doffing procedures. We're finding that a lot of laboratorians are not properly dunning or doffing their PPE prior to entering or exiting the laboratory. Oftentimes, we've seen that laboratorians are doffing their PPE prior to exiting the laboratory, which really defeats the purpose of having PPE if you're going to take it off prior to leaving the laboratory itself. Other common observations include laboratories not maintaining negative airflow as it should for a BSL-3 type facility. Infectious material being placed in non-leak-proof cardboard boxes for storage, transport, or processing. Which we all know cardboard is definitely hard to decontaminate and it is not made of impermeable material. Other observations include improper decontamination procedures and also lack of use of centrifuge safety cups during centrifugation, which is an obvious production of aerosols type of technique. Should be worked with carefully when you're using the centrifuge for this material. Other common observations include your inadequate biosafety plans or even your SOPs. Basically, if it's not written, it's not being done. So it's very hard to ensure the safety of personnel if you don't have practices and procedures that are written that identifies what they should and should not do while working safely in the laboratory. So this is a very critical component of a laboratory itself. Other observations include improper use of PPE, lack of maintenance of your HVAC system, or inoperable alarms for HVAC system failure, which is a concern for the laboratories inside of the laboratory and also for the environment or personnel that are outside of the laboratory if that system fails. Facilities re-verification. Now, this is something that should be done on an annual basis to verify that the laboratory is operating the way it was originally designed to be operated. So it's very critical to ensure that you are verifying this facility on an annual basis. And last but not least, personnel not being trained. This one I think is self-explanatory. And it's very important to train your staff to ensure that they are working safely in the laboratory and also are following all the procedures and practices that you have developed to ensure their safety while in the laboratory. Now, after the inspectors have inspected your laboratories and reviewed all of your documents, you'll receive an inspection report from our program within a 2-week time frame. Now, this report is basically the observations that the inspectors noted while at your facility, and is a request for additional information that you must provide in 2 weeks. So once those responses are received, the inspection team will take a look at them and verify that you have adequately addressed each one of the departures that were noted in that inspection report. Now, if not, you will receive what we call an inadequate response letter. Now, this is just a letter that we will supply to you asking for additional information in regards to those departures that were not adequately addressed. And this is also an opportunity for you to provide additional information regarding the departures that were noted in that inspection report. So there are a set of things that you can do to avoid what we call an inadequate response letter. The first is to provide an adequate and concise response to each specific observation noted during the inspection. Another idea or a thing to do is to provide responses that include pictures or other forms of documentation that the permittee may deem necessary to address each observation. And last and most importantly is contact the inspection team. One of the things that I emphasize for the staff is that we're not just here to enforce the regulations, but we're also here to provide guidance to the regulations. I often find that it's not that an individual doesn't want to comply with the regulation, but it's often that they don't understand how to comply with the regulations. So I just wanted to inform you all that we're always here to help you in any way possible if you have any question in regards to the regulations or your inspection report in itself. So definitely feel free to contact us if you're having problems with any of this type of information. So after you have adequately addressed each one of your departures from the inspection report, you'll be provided what we call an adequate response letter. Now, this letter signifies the inspection report is closed and that no further information is needed from you at that point in time. Now, after the issuance of your adequate response letter, you'll be provided your import permit at that specific time. And finally, I would like to end with a few frequently asked questions. I thought these will be beneficial for the participants in today's webcast. So starting with number one here, is there a fee for obtaining a CDC import permit? The answer to that is no. Currently, there is no fee for processing a CDC import permit, and at this point in time, we're not planning to charge a fee anytime in the future. The next question is an import permit required to import material that has received approval from FDA? No. Any product that is cleared, approved, licensed, or otherwise authorized under any of the following laws would not require a CDC import permit. Now, those laws include the Federal Food, Drug, and Cosmetic Act, Section 351 of the Public Health Services Act pertaining to biological products, or the Virus, Serum, and Toxin Act. The next question is, am I able to amend, for example, add, remove permittees, senders, or infectious biological agents to a current import permit? Unfortunately, the answer to that is no. Import permits are not amended and cannot be amended. Now, if there becomes a situation where you need an import permit expeditiously, then we'll be more than happy to expedite your application for an additional permit. But at this time, we're not able to amend any import permit that has already been issued. The next question is an import permit required to import a select agent or toxin or transfer the material within the United States? An import permit is not required to import a select agent or toxin into the country as long as that approval has been done through what we call a Form 2 transfer authorization from the Federal Select Agent Program. Now, this was another attempt by us to reduce the burden on the public by not requiring two different authorizations from two different programs for the same shipment. So at this time, you're only allowed or required to have a CDC Form 2 transfer authorization approved instead of a CDC import permit. Last question here is, what are the responsibilities of the importer once an import permit has been issued? Now, this is a very important question here, and the import permit is only issued to the importer located inside of the United States. The importer is responsible for ensuring that the foreign personnel package, label, and ship their inspection material according to federal regulation and international standards. So I do want to emphasize that it is your responsibility as the importer to ensure that these regulations and standards are being met by the sender of this material. Thank you. That is my time, and I will be more than happy to accept additional questions during the Q&A session later today. Thank you.